Just 7 months into using a popular weight loss injection, this man's blood became so acidic, it nearly killed him. Here's what happened when a 24-pound weight loss almost became fatal. BM is a 40-year-old male being rushed into the emergency room with severe abdominal pain. With a pale appearance and a fast heart rate, BM tells the medical staff that he has been vomiting for the past 4 days. BM then points to his right upper quadrant as an area of severe pain. The medical staff act fast as they know this is where the liver and gallbladder are located. Could this be some type of surgical emergency from an infected gallbladder? They quickly hook up BM to the monitor, send off a panel of labs, and learn more about BM's medical history. He tells the medical staff that 3 weeks before his presentation today, his entire family was struck with a bout of nausea and diarrhea for a few days, which resolved on its own. He has a history of heavy alcohol use, but he's changed over the past 6 years. He only drinks socially now, with his last drink about 2 weeks ago. There hasn't been any recent change in his diet. He follows a high protein, low carbohydrate diet, and no recent foreign travel. For medications, he injects Semaglutide or Wegovy at 1 milligram weekly, pantoprazole for acid reflux, and albuterol as needed for wheezing. Interestingly, the 5'6" BM says that he weighed 196 pounds when he started the semaglutide injections just 7 months ago. Now at 172 pounds, he notes usually feeling nauseous after his weekly semaglutide injections, but this resolves after a few days without any treatment. Suddenly, as BM is telling his story, he lurches forward and has a jolting episode of hematemesis, or blood in the vomit. The medical staff must act fast to reverse the cause of these strange symptoms. But first, let's take a closer look at BM and rewind to about 7 months ago. He was a guy who always struggled with his weight. For as long as he could remember, he was always a bit more fluffy than the rest of his friends. At one point, he tried the keto diet and he was able to lose about 20 pounds, but he couldn't keep up with it and gained the weight back. He would exercise 3 or 4 times a week with his friends, but he struggled with chronic knee pain that made intense exercise quite difficult. What's more is that he felt his size and his body was getting in the way of him meeting a partner of his own. He'd put himself out there to get to know new people, yet nobody seemed to look at him twice. It was time to take this weight loss to the next level.
Forming at the club, and you show the audience how
crisis control.
I can't feel my face.
That's the power of winning. We go big.
Here it was, week 1, and to think that just 1/4 of a milligram of this medication could be strong enough to transform his body. As the weeks passed, more weight came off, and now with a full 1 milligram weekly dose of semaglutide, he notices nausea for a few days after each dose. But it's tolerable, he doesn't think much of it, he loves the weight loss, so he moves forward. After 24 pounds of weight loss, BM develops severe abdominal pain. He's vomiting blood, which brings us back to the emergency room. We're back with BM and his blood work showing a critical emergency. The level of beta-hydroxybutyrate in BM's blood is sky high. This is a ketone body, and its level is 100.6, over 35 times the upper limit of normal. The large production of ketones makes the blood so acidic that organ failure, respiratory distress, and fatal heart arrhythmias are very real possibilities that could occur at any moment. You see, the differences going on in this case of ketoacidosis are very different from going into ketosis from a ketogenic diet. Orders of magnitude difference. The overall degree and speed at which one achieves ketosis from a ketogenic diet is the difference. Our body can generally maintain normal pH levels in the blood and use the ketone bodies for fuel, whereas in ketoacidosis, well, this instead calls for a trip to the intensive care unit for IV fluids containing dextrose, bicarbonate, and very, very close monitoring. After 24 hours, thankfully, there are no complications, and the ketone levels drop nearly tenfold. There are no additional episodes of nausea or vomiting, and on day 3 of his hospital stay, BM returns to a regular diet and is able to be discharged, making a full recovery. So what happened here and how can you avoid this? First, let's recognize the final diagnosis in BM, which was euglycemic ketoacidosis. Big words, let's break it down. And you may have heard of diabetic ketoacidosis before, or DKA. Euglycemic means normal levels of glucose in the blood. Whereas in diabetic ketoacidosis, we typically see sugar levels in the 500 to 600 range. Typically seen in type 1 diabetics, DKA occurs because we have high levels of sugar circulating in the blood, but no insulin to actually put it into our cells. Hence, we need to use other forms of fuel, ketones, ketoacidosis. The ketoacidosis in this case works a little bit differently and through a process called starvation ketoacidosis. You see, these GLP-1 analogs like tirzepatide, liraglutide, and semaglutide help you feel fuller longer. They slow the transit of food through your GI tract, and so you eat less. And this is only the second documented case of a ketoacidosis from a GLP-1 medication. For BM, medical providers in this case felt that it was a combination of semaglutide with a low-calorie intake, dehydration from the diarrheal illness a few weeks earlier, and some prior liver damage from heavy drinking several years ago that can cause some abnormalities in glucose utilization, all contributed to this severe illness. It should also be noted that the FDA recently issued some updated warnings in October of 2024 about these GLP-1 medications. Due to the cost of the medication, many companies are choosing to compound the medication themselves, which can lead to potential dosing errors from improper preparation. It's not clear how BM obtained his semaglutide from this case, but based on the data, it is entirely possible that he received a dose beyond what was marked on his pen injector. Plus, some companies are using suppliers that use the salt form of this medication, and these are different active ingredients than those studied to approve the medication to begin with. And the FDA directly says that we are not aware of any lawful basis for their use in compounding. Yikes. With booming demand of these GLP-1 medications, it seems that every week there's a new online weight loss telemedicine company. If you're looking into this for yourself or a loved one, it's probably a good idea you ask your provider where they are sourcing their medication. These medications have a lot of upside. They're pretty safe, but certainly there are a lot of risks to be aware of. If you're getting this medication, make sure it is through a reliable healthcare provider who is sourcing it legitimately and following prescription guidelines. My name is John. I'm a physician assistant. I've been working in internal medicine and I now have over 2 years of experience. And yes, I do prescribe some of these medications. I have a ton of information in the video description. I have all of my references and resources. Thank you so much for watching. Stay safe out there. And as always, don't forget to live your lives out loud. Bye.